Paige, I'm Brittany. I'm going to be your nurse today.
Hello.
So what brings you in today?
Okay, it's going to sound kind of silly, but I was volunteering at a homeless shelter last week, and they told us that this man was HIV positive, and he sneezed all over me, and so I've just been kind of freaking out about it ever since and figured I would come in today and get tested.
Okay, well I don't want you to worry too much about that because that's not how HIV is transmitted, but we'll go over that with a few questions. Is that okay?
Yeah.
Okay, so do you know what HIV is?
Honestly, not really.
Okay, it stands for human immunodeficiency virus, which just means when it gets into your body, it makes it hard for your body to fight off infection, and it can slowly lead to acquired immune deficiency or sometimes AIDS.
Okay.
Okay, do you know the common symptoms of HIV or AIDS?
Just that you feel sick all the time.
Okay, normally when you develop HIV, in the beginning it's asymptomatic, which means symptoms don't normally show up outwardly, but when if it develops into AIDS, you can get flu-like symptoms and you feel sick all the time and it's hard to fight off infections.
Okay.
Do you know how HIV is transmitted to a person?
Just like close contact with someone that has it?
Not exactly. You have to come in contact with that person's blood, semen, vaginal secretions, pre-ejaculate, or breast milk. So having unprotected sex, using needles with drugs, from mother to baby during birth, delivery, or breastfeeding.
Okay.
So it's not spread from like person to person through water or air, so when you get sneezed on and coughed on, you don't have to worry about that.
Oh, okay.
And finally, do you know effective ways to prevent HIV?
Protecting yourself during sex?
That's one of the ways. Obviously, abstinence is the best way to prevent it, but using barrier methods during sex, like condoms, is a good way. Limiting your sexual partners. Avoid using drugs, especially those that you have to inject with needles. And if you ever think you have been exposed, to seek medical attention immediately. So after going over this, do you still think you might need to get tested because of any of the risk factors?
Maybe.
Okay, well, we can set up that appointment for you today, and then we'll have you come back in about 3 months to retest you because sometimes it takes that long for HIV to actually show up.
Okay.
So before we go back, I'm going to go over these one more time with you to make sure you understand.
Okay.
So do you remember what we talked about, HIV, like what it is?
HIV is a human immunodeficiency virus that can lead to AIDS.
Mm-hmm. Do you remember the common symptoms we talked about?
Yeah, HIV is usually asymptomatic, but once it develops into AIDS, you get recurrent infections because it lowers your immunity, and you just feel sick all the time with flu-like symptoms.
Good. Do you remember how it's transmitted?
Through blood, semen, vaginal secretions, breast milk,
Mm-hmm.
and
yeah, that's good.
Okay.
And finally, what's the best way to prevent HIV?
Abstinence is the best way, and also limiting your sexual partners, using barrier methods such as condoms, using or not using sharing needles during drug use, and seek medical attention if you think you are exposed.
All right, very good. We'll go ahead and go into the back and get you set up for your test, and I'm going to give you this HIV pamphlet.
Okay.
It just goes over everything we went over today.
Okay, perfect. Thank you.
You're welcome.